And welcome back to Notre Dame Day. I'm Colleen Wilcox. Notre Dame has established itself as a training ground for future doctors. Nearly 1% actually of all doctors in the United States get an undergraduate degree right here from the University of Notre Dame. And the university has also become very well known for rare disease research, thanks to the efforts of the Parseghian Center for Rare and Neglected Diseases, the Parseghian Medical Research Fund, and many research labs on campus. Notre Dame's newest contribution to healthcare is patient advocacy. And joining us next to discuss the patient advocacy initiative is Barbara Calhoun and Sean Kassen. Barbara is the Reisenauer Family Director for the Patient Advocacy Initiative and the Director of the Minor in Science and Patient Advocacy. Sean Kassen is the Director of the Parseghian Medical Research Fund. First of all, welcome to Notre Dame Day, Barbara and Sean. We're very happy to have you.
Thank you.
And first of all, Barbara, what is a patient advocate and why are they so important?
So in general, a patient advocate is a professional who provides services for patients and families as they navigate through the healthcare complexities, whether it be insurance or otherwise. But what we're focusing on is rare disease patients. So there is an incredible burden, not only with all the unknowns, but generally what they go through. So like a rare disease is any disease that affects less than 200,000. And there are 7,000 rare diseases, but very few people have a rare disease of each of those. So there are a lot of burdens that they have, including a long time to diagnosis because the doctors have never seen the disease. We have limited number of researchers and limited number of specialists, and oftentimes families have to go out of state to get the care that they need where the specialists are. And even after all of that, there are only 5% of all rare diseases have an approved treatment. So they are up against a lot of roadblocks. And so we have strived to get students at Notre Dame trained to be advocates for rare disease community.
Yeah, that is very important work. Thank you for everything that you do. Can you talk a little bit more about the Patient Advocacy Initiative at Notre Dame and how you're really training students for this really important field?
So it's the Patient Advocacy Initiative was established on the foundation of the research that was going on in the Parseghian Center for Rare and Neglected Diseases. And in 2008 or 9, it started researching one rare disease, Niemann-Pick type C. Currently, they study 21 diseases. So we have in our lab the opportunity to increase patient engagement with students. So we started a minor in Science and Patient Advocacy in 2021. And we have multiple entities that comprise this minor, but we teach students to read patient medical records in order to understand the symptoms of disease and how they progress over time. We have students partner with patients and learn their experience of living with the disease and raise awareness through storytelling. We partner with patient service organizations. We have guest lectures in class. I mean, patients are the experts, so we have them in class to actually, teach the students what it really is to have a rare disease. So we have clinicians, all these other entities that come into class. We also have two events, one in the fall, the Patient Advocacy Summit, and then we celebrate Rare Disease Day in February. And I just feel like with all of that, we are training and providing students with the skills they need to be effective patient advocates.
Yeah, absolutely. And Sean, Cindy Parseghian has appeared, of course, on our broadcast for many years, talking about Niemann-Pick type C disease and, of course, the impact on her family. And this year, we're running a special spot about the impact on how funds raised for the Parseghian Medical Research Fund will be used to advance NPC disease research. So on the topic of supporting research, what does the Parseghian Fund do in the area of patient advocacy?
Well, what I think is important to know is that Cindy and Mike Parseghian were patient advocates first. Here you have this couple with young couple with 3 children just diagnosed with this very awful rare disease. And, you know, they have to navigate that in a world where this is back in 1994 and nobody knew anything about NPC and even PIC type C disease. So even before they founded their foundation, you know, they knew this was going to be critically important for the research effort. So when they founded the foundation, it primarily is focused on research, but we definitely have an advocacy arm because we know that's part of the process. And so now today when patients and families are diagnosed with this rare disease, they can look to us and other organizations, and we can help them guide them on, this journey that they're going to have. And one thing I'll just always say is it's important to keep the patient voice first. So whenever we're looking at things that we're going to be supporting research-wise, is this going to advance treatments for patients with NPC, and especially, advanced treatments for, what is most important for those patients.
Yeah, and then continuing on from that question, your response. So how does the Parseghian Fund work with the Patient Advocacy Program initiative here at Notre Dame?
So we work with multiple ways. Barb is phenomenal at her role there. And, first, as she mentioned, just engaging families and patients with the students is critical. So there's opportunities every year to be able to do that. And so what we do is, at our class, we just, bring families in, they engage with them there, they engage with them at some of these advocacy events that she mentioned. They also work at some of the clinical data that Barbara was mentioning. It's going to be very important for them to learn that going forward. And every patient that's diagnosed, that data that they have is extremely valuable. And so we try to teach students that that's really important, and just giving them that real-world experience. And then, of course, we partner on multiple advocacy events throughout the year.
Oh, that is wonderful to hear. And final question, Barbara and Sean, rare disease groups do very well at fundraising during Notre Dame Day. So can you tell us what each of your organizations are raising money for specifically?
Well, I guess I'll go first.
Yeah.
First, thanks to everybody that's supporting us. It's been absolutely phenomenal, the turnout. But it's simple. We raise money to find treatments and ultimately a cure for this disease. So every dollar that we raise not only is going to be matched, but it's going to go right back out to support research. We're very hopeful that we might have one, possibly two therapies approved for the first time in the United States. Hopefully in the fall, we'll have a big party.
Wow, that's incredible.
And, but also we're supporting that, trying to get that over the goal line, but also the next generation of therapies that we think will be that game changer, or that cure that families need.
Yeah. And I'm here to represent the Parseghian Center for Rare and Neglected Diseases, as well as the Patient Advocacy Initiative. And I just want to say that I'm here for all rare disease patients that need us, and we're so grateful for the funds and donations that they have given, as well as the donors. And without them, we would not have this program. So we are really excited about the future, and we're here for them.
Yeah, well, I just want to thank you two so much for all the incredible work that you do. And thank you for joining us here at Notre Dame Day as well.
Thanks for being here.
All right, thank you. And don't go away. Coming up next is an exciting dance performance by the Vietnamese Student Association. Stay with us.